Hello and welcome to this education series on Cyrex Labs. I'm Robyn Puglia. I'm the head of education for Cyrex Labs for the UK, Europe and Ireland, and I'm a consultant for Regeneris Labs. And in this first video, I am going to be introducing you to Cyrex, and we are going to talk about what we do and why we do it. So first of all, Cyrex Labs is a specialist functional immunology lab focused on assessing and understanding and also educating and empowering in the subject of environmentally induced autoimmune disease. We have a range of proprietary tests, a range of patented panels and specialist techniques that really makes us unique in the field of functional immunology and also functional medicine testing. Our advisory board is made up of scientific researchers, but also clinicians. And this is very important because the needs of the clinician is really at the heart of what we do with our tests. We have a range of pillars of excellence, which I'm going to be talking to you about, that we really adhere to as the core of our business practices and our lab practices because they are what make us valuable to you, the clinician. Functional immunology is really at the center of everything we do in clinical practice because every organ system in the body has an immune system. If you really think about it, we don't have liver in our heart, we don't have liver in our brain, we don't have liver in our muscles, but we have immune system in our liver, in our heart, in our brain, in our muscles. So understanding the immune system is fundamental for every aspect of clinical practice because it's deeply entwined into healthy function of all of our different organ systems and our body as a systems biology, whole interconnected system. But it's also often at the root of dysfunction. So whether or not you're working with metabolic dysfunction, infertility, or athletic performance, or even optimizing health, understanding the immune system in the context of the environment is really pivotal. Sorry. So at the heart of Cyrex is this man here, Dr. Aristo Vojdani. So Dr. Vojdani is a microbiologist and clinical immunologist. And he is an adjunct associate professor at multiple different universities. He has 17 patents for lab assessment of immune disorders dating back decades. This man has devoted his life to understanding the immune system in the context of clinical practice. Even though he's a laboratory immunologist, the forefront of his thinking and the development of the tests that he has been involved in is how does this change the life of the person who we are serving. Dr. Vojdani has published more than 230 articles in magazines and peer-reviewed scientific journals. He's been cited almost 6,000 times, which puts him really at the top tier of scientific researchers globally. Dr. Vojdani's research has resulted in the development of more than 350 antibody assays, again dating back to the 80s. He sits on the editorial board of 5 scientific journals, and as well as being the chief scientific advisor for Cyrex Labs, he's also the CEO and technical director of Immunosciences Labs in Los Angeles, California. Over the years, Dr. Vojdani has received many awards, including the Herbert Rinkle Award from the American Academy of Environmental Medicine. He's achieved the Linus Pauling Award from the American College of Advancement in Medicine and the F.R. Carrick Research Institute's Lifetime Achievement Award. Almost everything that we know about autoimmunity and immunology in autoimmune disease in clinical practice is based on Dr. Vojdani's thinking around autoimmune disease and also his dedication to researching and understanding the role of infections, toxins, and foods in the context of the immune system. So why do we do what we do? Everybody from the clinicians involved in the company and all the way through to the top of the food chain with Dr. Vojdani understand that working with autoimmune disease is deeply personal, that you, the clinician, and for the person who the test is for, this is about their life and the stakes are high and meaningful. Autoimmune disease affects 10% of the population in the UK and somewhere around 7% of the population in the EU and also the US. Autoimmune disease dramatically affects quality of life for the person affected, but also for their families. So when we say this is personal, we understand that this means time with children, career goals, pain. It's not just about working to a test result. It's actually about the affect on the person and their family. Autoimmunity is present in the body for years or even decades before it reaches diagnosable disease. So early detection and understanding the perturbations of the immune system becomes critical because it helps us to prevent years of suffering. Understanding the individual's unique combination of triggers allows for effective personalized interventions. And this is actually key for effective management of diagnosed illness, but also for preventing developing illness with autoimmune disease. So functional immunology is at the core of our lab. This man that you can see on the screen here, this is our other career immunologist. This is Dr. Sadi Koksoy, and he is the head immunologist of the lab in Phoenix. And he takes his responsibility to the patients very, very seriously. Every person working at the lab understands that this is patient-centered work that they're doing. It's not about the esoteric science, that everything that we do is about connecting through to the clinician who is serving the patient. Every person that works at this lab is deeply committed to the impact of their work. It's really about the clinician, serving the patient. So to develop an autoimmune disease, it is considered that we need to have three factors in place, the three legs of the stool of autoimmune disease, that there needs to be genetic predisposition, that there needs to be immune system dysregulation, which is usually mediated by barrier permeability of some kind. We talk a lot about the gut, but actually this goes quite far beyond the gut as well, and it's important to understand as many of the immune barriers as we can. And then the third variable is the environmental trigger, the environmental interface. And even with something like celiac disease, where we have one known trigger, gluten, we still need to understand what was it that broke tolerance to gluten and understand the role of dysbiosis, fungal burden, infections, toxins, stress, and barrier permeability. So the genes load the gun, but the environment pulls the trigger. And understanding not just the immune regulation and environmental triggers at the initiation of autoimmune disease, but also understanding that we might be 10, 15, 20 years into immune system dysregulation and environmental perturbation of the immune system. So understanding what is true now is a really important part of understanding how do we move this client or patient away from the dysfunction where they are towards improved function and better health. There are three stages of autoimmune disease development. So the first stage of autoimmunity is silent autoimmunity, where there are antibodies present, but there are no symptoms that are directly correlated with the autoimmune disease, and no significant loss of function of that tissue or of that organ system. Identifying autoimmunity at this earliest stage allows us to be the most efficient and most proactive in preventing the development of diagnosable illness. Stage 2 of autoimmune reactivity is elevated antibodies and symptoms associated with immune system dysregulation. These may be mild, or they may be so significant that this person is seeking medical help and medical attention. They still haven't arrived at the point of diagnosable illness, but if you can understand the immune system red flags and join the dots between tissue antibodies and immune system dysregulation, again, this allows us a really important clinical window to intervene before we get to diagnosable illness. Stage 3 autoimmune disease, we have elevated antibodies, symptoms that may be severe or life-altering. We have tissue destruction that is measurable now on imaging, and we have diagnosable disease. So the earlier we can intervene, the more effective our interventions can be. So you can see that we have a broad spectrum between healthy function of the tissue or the healthy body and the degeneration and deformation of tissue that accompanies diagnosable autoimmune disease. And right at the earliest phase, we have immune system dysregulation caused by an environmental trigger or a series of environmental triggers over time. And those include infections, toxins, foods, but also often the intersection of stress and HPA axis dysfunction. So we then move through the pre-symptomatic phase where we have antibodies present through to this dynamic symptom threshold where life has been changed by immune system dysregulation. And it's important to understand that in between autoimmune initiation and diagnosable disease, that life continues, that this immune system, which is now in a dysregulated state, is continuing to be exposed to endocrine dysfunction and environmental triggers, but they are layering now over the top of an immune system that doesn't come back to healthy homeostatic baseline and is functioning as an autoimmune system. So understanding the immunology and that, the immune system's responses change, but also that the person's continuing to accumulate environmental exposures. So if we assume that something like Epstein-Barr virus was the trigger over here, and now we have autoimmune activation, what we might see is that this person moves through 15 years, and during that time, they go through a bereavement, they go through a pregnancy or two pregnancies or pregnancy loss, they have multiple infections, urinary tract infections, maybe they get COVID a couple of times. And so understanding the immune journey and understanding that we are layering layering environmental exposures onto a dysregulated immune system means that it's important to understand we're not just looking for the magic bullet. We need to understand the full scope of the environmental milieu around that is affecting the immune system for this person. And because that's important to understand, the Cyrex system incorporates a full spectrum of testing to look at essential barriers, multiple different tests that look at function of very important immune system barriers and mucosal surfaces. We look at cognitive health, the mucosal immune system, which functions as an independent but interconnected arm of the immune system. We're looking at autoantibodies, so understanding predictive antibodies all the way through the journey from phase 1 of antibody production all the way through to what is present at diagnosable illness. And of course, we have a suite of tests that help to really effectively investigate the environmental triggers. And those environmental triggers include a full range of dietary proteins, chemical immune reactivity, and also, of course, a suite of infectious agents that are directly implicated in the development and also the perturbation of autoimmune disease. So we are unique in the landscape of functional testing. We are a specialist functional immunology lab, which really focuses on assessing and understanding and also educating the patients and the practitioners on environmentally induced autoimmunity. We have a range of proprietary tests. We have a range of patented panels and techniques. We have an advisory board that's made up of clinicians and researchers because we need to understand the science and we need to have a really cutting edge team of scientific clinical immunologists, but we also need to have the clinicians and the service to the patients be at the core of what we're doing. Cyrex Labs at every level has a really deep commitment to accurate, reproducible results. And the reason for that is because we must support you, the clinician, and to be able to connect the science all the way through to the patient's real life. And we do that through our pillars of excellence, which will be my next video. Thank you so much for your attention.